Call this meeting to order. Whereas there is a quorum of council present and a time of 6 p.m., be it resolved this regular meeting be open for business via Zoom and that the minutes of the regular meeting of January the 12th, 2022 be approved. Can I have a mover and a seconder?
Pat will move.
Pat will move it and Kevin will second it. There, I seen his hand go up.
I'll second it, yes.
Yeah. Kevin, for or against?
I'm for it.
Pat?
Pat in favor.
Glenda?
In favor.
Cheryl? Dale, are you here tonight?
Dale isn't on, no.
Okay, motion carried.
No, I
Has
think,
anybody,
sorry, Dale is just coming in now.
has anybody got a conflict there tonight there in regards to the agenda or anything there?
Glenda, no.
Pat,
None for
no.
me.
Hearing none there. Can we add to the agenda there, the regular agenda borrowing bylaw? This resolution here, be it resolved, the following be added to the regular agenda, G4 borrowing bylaw renewal. Can I have a mover and a seconder?
I'll move it.
Kevin will move it there. Seconder?
Cheryl.
Cheryl? Kevin, you're for it?
I'm for it.
Pat?
In favor.
Linda?
In favor.
Cheryl?
Favor.
And Dale?
In favor.
Motion carried. Nancy Lacoste, are you on the air?
Yep.
Yes, I'm here, Mayor Gamble.
Yeah, good evening there. You got a presentation there you want to share with the community?
I do. I actually have a few members of the Espanola Area Ontario Health Team with me this evening to co-present. And one of those folks, John Brunetti, will display the slides for us. And I will ask Jane Battistelli to start things off on our behalf.
I'm just getting.
Sorry, just quickly, I'm unable to screen share.
Yeah. Okay, that's in the make host. Okay, I'm going to make you the host for now and you can give it back to me after. Okay.
Thank you. So I'd just like to thank Mayor Gamble and Council for providing us with the opportunity to present on the progress of the Espanola and Area Ontario Health Team. My name is Jane Battistelli and I'm the Chief Operating Officer at Espanola Regional Hospital. And I've been involved with Ontario Health Team work since the current government called for the creation of Ontario Health Teams. Over the past 3 years, Nancy, John, and I have been involved with our community partners in developing the framework for the Espanola and Area Ontario Health Team, which covers the catchment area from Walford to Worthington to Whitefish Falls. The goal of this work will be discussed in the presentation, and I'm going to let John and Donna of our Leadership Council introduce themselves, and then Nancy will lead us into the presentation.
Good evening, everyone. My name is Donna Stewart, and I'm the Associate Chief Administrative Officer with the Manitoulin and Sudbury DSAB. Over to you, John.
Everyone, John Brunetti, Primary Care Manager for the Espanola Hospital, and also the Chair of the Espanola and Area Community of Care Planning Network.
All right, great, thanks. And while John moves us on to the next slide, I'll introduce myself. I'm Nancy Lacasse. I am the Espanola and Area Ontario Health Team Advisor, helping out with advancing this work in parallel with pandemic, I guess. It was put on pause for a wee bit during the pandemic and we're starting things up again. So I'm most pleased to be here with you this evening. I do live in the community of Espanola and have a vested interest in healthcare delivery in our area have been involved for a number of years. So happy to be here with you this evening. Really what we're hoping to do tonight is to give you a little bit of background on Ontario Health Teams, tell you more importantly about the status of the Espanola and Area Ontario Health Team, but more importantly, just to solicit your support and have some discussion for how we need to move forward to improve health and social services in our area, which most definitely impacts Massey as well. So just by way of background, just wanted to share with you that this work dates back to 2018, when the current provincial government came into being. They were very much involved in the creation of an expert panel that was going to look at how to end hallway medicine and how to improve healthcare across our entire province, actually. And this expert panel traveled coast to coast across the province, met with stakeholders, system leaders, but more importantly, patient and family and caregivers of folks that were consuming the healthcare system. From that emanated a number of recommendations, one of those being the creation of Ontario Health Teams that we will talk a little bit more about. But I just wanted you to be aware that this broad consultation was inclusive of making sure that we talk to Indigenous and Francophone populations and the families, patients, and caregivers that consume the healthcare system, so that the recommendations could be well informed and equitable for a number of populations. So in 2019, the People's Healthcare Act was passed, and this was the piece of legislation that would enable the Ontario Health Teams to move forward. So just John, on the slide of regarding what are Ontario Health Teams. Essentially, very simply put, an Ontario Health Team is a way of further integrating and coordinating healthcare, health and social services, actually. And it is a group of professionals from many sectors, many of which are listed on this slide before you. But it's really looking at ways that we can make the system easier for patients and families to navigate. I'm sure that all of you have experienced the healthcare system at some level, and you know that there are sometimes challenges with being able to go from service to service. And so the intention of an Ontario Health Team is to have all of those providers come together, work together, and look at how that could be improved. And this will not be a system where patients have to sign up to be in part of an Ontario Health Team. It will be very much a continuation of our current status with some really good enhancements on how we might improve the journey for patients and families. And I will share with you that Espanola and area is a little bit ahead of the game, because you may remember that back in, it must have been around 2017, the then Liberal government gave some funding to Espanola and area to look at rural health hub development. And essentially what that was looking at how we could, again, better integrate, coordinate, have care partners collaborate together. So we have a good foundation to build from, and Jane will talk to you a little bit further on about what exactly we have done since that time. But I just wanted to give you a little bit of information regarding how many Ontario Health Teams there are in the province. The goal of the ministry is to see every community be covered somehow by an Ontario Health Team. Right now, in the province of Ontario, there are 50 Ontario Health Teams. Here in the north, and in particular in the northeast, we have 2 fully approved Ontario Health Teams, one being in North Bay and the other being in Algoma. And then we also have 15 other communities, Espanola and area being one, that have submitted their interest to the ministry to be an Ontario Health Team. The ministry has reviewed that interest, but has said to these communities that there's some work that needs to be done to further further advance towards becoming a full Ontario Health Team. So that's the status that Espanola is at right now. And I can tell you that Manitoulin Island is very similar status. They've applied to have an Ontario Health Team, have been told that by the ministry that they have a little bit of work to do. And then just further west past yourselves, the Blind River area, East Algoma, also has the same status with the ministry. So we find ourselves in the north, working very collaboratively with Ontario Health North, and we'll talk a little bit more about that in the future for our work on Ontario Health Teams. On the slide that John has up right now, it just speaks to when a Ontario Health Team is fully approved and is mature and has been fully functioning for a couple of years. These are some of the key deliverables or changes that we may see in our healthcare system. And the one that I want to highlight for you today is the idea of 24/7 navigation services. So many of you will know that a lot of health and social services providers work Monday to Friday, 8 to 5. And sometimes if you're a patient or a caregiver, family of someone consuming the service, it's sometimes difficult to get assistance after hours and on weekends with navigating parts of your healthcare journey. So we've been really fortunate with our Espanola and Area Ontario Health Team to be successful in receiving some funding to start working on this 24/7 concept of navigation services. And we'll talk a little bit more about that further on. Just next slide, John, please. I just really put this slide before you today because I wanted to emphasize that patients, families, and caregivers need to be part of the design of our healthcare system going forward. And this is something that is supported by the ministry. The ministry has a provincial patient advisory council who have been very involved in the development of Ontario Health Teams across the province. And they have adopted this core set of values for the work. And I can tell you that locally with the Espanola and Area Ontario Health Team, these are the values from which we will work with in regards to patients, families, and caregivers. And we've done a lot of work in the last number of weeks with our local patient advisory committee to profile Ontario Health Teams and these provincial standards. And I believe in your agenda package this evening, you also received a copy of the recruitment flyer that we're using because we want to ensure that we have patients, families, and caregivers from the entire catchment that we serve. And so we've provided that information for you and we'll make a formal ask to you a little bit further on in the presentation. So just next slide, I'm going to invite Jane to talk to you a little bit more about the status of the Espanola and Area Ontario Health Team.
So this slide really depicts our journey to date. So it started in 2019 when we submitted an application. And then we had a few conversations with the ministry. And then in terms of work, the pandemic hit shortly after. So in 2021 of September, we really started to engage in conversations again with the ministry in regards to moving forward with Ontario Health Teams. So really, it looks at a new way of delivering care that brings together the healthcare providers and organizations to work as one coordinated system or team to deliver care. And there was 4 main objectives that the ministry highlighted that we're trying to achieve. So improving patient and population health outcomes, like Nancy said, enhanced patient and family and caregiver experience, enhanced provider experience really as well, just trying to help providers to stay connected and improve value to all the users of the system. So really our team is looking at how we can be a connected system to the region and to specialized services while still maintaining our autonomy as a rural catchment area to deliver services locally to the members of our community. So as Nancy said, there have been some funding opportunities. One is the patient navigation product. And the second one we just received funding for was to work on a patient portal just to help patients actually access their health records or test results. So we're just in the beginning of investing in that project. So that is something that we're happy to receive funding for. Next slide, John. Really, we really wanted to highlight some of the local innovation and collaboration that has been happening, and really the work that we've done over the past couple of years with the Ontario Health Team has really helped to bring partners together. So in 2017, the hospital received some funding for a 1-bed hospice suite that is located on our acute care unit, and really looked at our catchment area, and there was no real palliative care or end-of-life program that covered the entire area. So worked with the family health team and have expanded that work since to several community partners, just in order to enhance and connect patients so they can access coordinated support through their palliative or end-of-life journey. So over the past 5 years, we have grown to have a really strong palliative care committee that includes home and community care, our long-term care, the hospital family health team, a Mwesing and Sagamok wellness unit, as well as community paramedicine and the Cancer Center Symptom Management Clinic. And through the work of our team and advocacy to the ministry and Ontario Health, we have just received an announcement that we will be funded for a palliative care nurse practitioner for our entire catchment area. So that's really going to change the landscape and really improve access and coordination of those services for patients in our community, and really partner with community paramedicine, and they're looking to be trained in palliative care as well. So it's really going to enhance the services that we're able to provide. Go ahead, John.
So that's back to me. You may be thinking healthcare is a provincial responsibility, and absolutely it is. But I'm here to say tonight that we cannot do this work without you, your local municipal leadership, and your support. You are the community leaders and the policymakers in your communities, and we need to explore opportunities now, how we can further our partnership with you and strengthen some of the work that you're doing in terms of trying to create a healthy community for your catchment area. And so John mentioned earlier that we have the Community of Care Planning Network table, and this is a system-wide table where we've had opportunity over the years to have not only health and social services part of that table, but other sectors like municipal leaders, like policing, like education. And as we move closer towards formalizing the work around the Ontario Health Team, we need to think about opportunities where we can tap into your leadership and your advocacy and support as community leaders. Certainly it goes without saying that at the municipal level, physician recruitment is important, and physicians are an integral component of an Ontario Health Team. So we need to continue those conversations as well. We know that you have very active and strong partnerships with folks like the DSAB and public health, and we need to look at ways that we can further advance that as we try to strengthen the health and social services system for our entire catchment area. And then just finally, in terms of thinking about infrastructure as it relates to healthcare, I know as a municipal leader, I assume that when you think of infrastructure, you're thinking roads and pipes and sewers and water, that sort of thing. But I think it's important for us to think about healthcare infrastructure as well as we plan for our communities. How can we make it attractive for healthcare providers to come to our area, and look forward to some opportunity to have conversation about that as well. Next slide, John. So at this point, I'm going to turn things back over to Jane and ask her to speak about what's next, please.
Sure. So what's next? In order to reach the goal of covering our catchment area with an Ontario Health team, we are scheduled next week to actually meet with partners across our sub-region. So that means Sudbury, Espanola, Manitoulin, and Parry Sound will be meeting, and just to look at discussions that revolve around regional healthcare delivery and looking at those regional services or the specialized services in those pathways. And at that table, we will continue to advocate and demonstrate the desire for Espanola and area Ontario Health Team really to maintain our rural work, to improve local service delivery, and just ensure there's equitable access to care and services where our patients or members live. So throughout the development of the Espanola and area Ontario Health Team, we have developed a leadership council. So those are agencies that have decided to be core partners in the Ontario Health Team and bring those stakeholders together. So our acute care system, long-term care, primary care, we have home and community care, Alzheimer's Society, and Manitoulin and Sudbury DSAB. So in terms of those partnerships, I'm going to hand it off to Donna just to talk about some of the neat and innovative things that are being done to improve services for our catchment area.
Thank you, Jane, and through you, Mr. Chair. So collaboration and partnerships are key, as you've heard from Nancy and Jane this evening, as we move forward with this OHT initiative. Some of you may already know that the service providers in the La Cloche area have already been partnering on a variety of different initiatives. And a few synergies that come to mind that I'd like to share with council this evening are, first and foremost, we have our community paramedicine program, which is basically based on a referral system from the doctor when a patient is being discharged. So our community paramedicine team at the DSAB will visit that individual for further follow-up, and they'll contact the doctor for further consultation, and they'll give that doctor an update on the patient's health care, which basically keeps them out of hospital, which is a definite bonus for everyone involved. Another example I want to highlight is our non-urgent patient transfer service. And that's basically an initiative that was created in partnership between the DSAB and the Espanola Hospital, as well as the Manitoulin Little Current Hospital. And last but not least, a wellness program that's been established in our Webwood area is a partnership between ourselves, the DSAB, and the Espanola Family Health Team, which allows the health team to provide primary care programming, OHT service, or sorry, OTN services, and virtual visits to those in the community who can't travel into Espanola for healthcare services. I attended the Roma conference yesterday and the day before, and I want to reiterate to this group that the minister did speak at that conference that there is an importance for the DSAB to be involved in this OHT process, and we're very happy to be included. So we, just as well as everyone here tonight, want to improve the health and well-being of the residents in the area, as it does impact the social determinants of health. So I'm going to turn it over to John at this point, because the group has an ask of council this evening. So John, the floor is yours.
Great, thank you, Donna. So just really quickly, just to kind of summarize, I mean, a lot of information has already been shared with you, and just really giving you an idea of sort of what is happening with Ontario Health Teams. And I think that right now there's just a few things that we are looking for municipal leadership to help out with. Obviously, we're hoping that there's going to be some type of representation on the Ontario Health Team Leadership Council. My understanding is that there is the Municipal Association meeting is coming up. I believe it's next week, where we're hopeful that we will be coming back as well to that, just to get an idea of how each of the municipalities within the catchment area would like to be part of our Ontario Health Team. So this is sort of our final roadshow. So we have been to Nairn, McCarrow, Espanola, and now to yourselves, providing the same presentation, just to ensure that everybody throughout the catchment area is really aware of what we are up to. And again, like I said, it's really just how we can really start to see more synergies with local leadership with within our Ontario Health team. The other piece, which Nancy alluded to earlier, is really the support and recruitment for the Patient Advisory Council. So you will have, in your packages, the information, but it really is imperative that we do have, again, community representation from across the entire catchment. We really just want to ensure that everything that we're doing is done with a lens of equity, and is really allowing those from the entire catchment the ability to have their say in what our Ontario Health team is going to look like. So getting in, sort of at the ground level and really being able to help us build a system that's going to work for everybody. And finally, not something that hasn't been happening through the council already, but it's just that continued provincial advocacy. This is something that we are asking all partners to do, whether it's every agency that's sort of sitting around the Community Care Planning Network table, as well as all councils. Again, not saying that this hasn't already been done, but we really need to continue to work with the province and everybody sort of rowing the boat in the same direction, and just making sure that these healthcare initiatives don't sort of go to the wayside. So recognizing that council does have the Community Safety Wellbeing Plan that was sort of developed, and I really feel like there's a lot of strong synergies between Ontario Health Team and sort of that mandate that is within, out to all the municipalities as well. So really looking forward to seeing what the next steps are going to look like, again, for both Ontario Health Team and the Community Safety Wellbeing Plan, and how we start to move a lot of these things forward. So thank you very much.
Nancy, you any more comment there you want to make?
Through you, Chair, no, not at this point, but we're happy to take any questions from yourself and council.
Nancy, when you look at there, we're forming small community groups there, health unit groups there around the area there, which is excellent because it touches on to your own personal people in your area. But do you see the government expanding that to regions there in the end, or what? How do you see the government going with this?
I think if I'll start, and I think if I understand your question correctly, Mayor Gamble, I think you're asking me if there will be regional structure to health system planning. And what I can offer to you is that, as Jane shared earlier, we're very actively involved with Ontario Health North, and they are your health system planners for the North, and they are working with us to look at how we can structure the Ontario Health teams so that every person in Ontario is covered by an Ontario Health team. So that it's still very actively in discussion right now. And Jane Battistelli is our representative on that regional group that's having those conversations and informing Ontario Health North, who will make a recommendation back to the province. So I don't know, Jane, maybe you want to add something further to that.
I think that's a great summary, Nancy. The only point that I'll just make again that I've made before is that we are very passionate about local rural care staying in local rural hands. We know what our patients, we know where the gaps are, we know where they're accessing care, we know what to advocate for. And I think as a team, looking at our entire catchment area and looking at where the connections are and the synergies are, we can do some really great work, but we just need to make sure that our voice is just as loud as our urban partners, and making sure that local care is represented.
Well, we all totally agree with you there, and that's where municipalities have got to get behind their small local is the #1 way to go there, because you're representing your people in your area.
And as Nancy and John have both said, the patient voice is, the ministry really is putting great emphasis on the patient voice. So in terms of patient advisory councils or a representation on our Ontario Health Leadership Council, really the voice of each community is going to play a big role in where we're going to be going in the future. So just really appreciative of this opportunity for our Leadership Council to present to you and to we're open to any feedback. If it's not at this meeting tonight, certainly you can connect with Nancy, myself, or John or Donna, and we would be happy to answer any further questions.
Has any councillor got any questions you want to ask there tonight there?
I just have a few concerns. I really like the concept, seamless coverage for care, whether it's addiction or mental health, whatever, because the world doesn't just work 8 to 4, you know. Now, my fear, though, is that if this gets spread too thin, and what I mean is beyond our catchment area, the 4 communities that you mentioned, we're going to get lost in the shuffle. So let's hope it remains local within our catchment area, because if it gets spread to Manitoulin and Elliott Lake and the whole gambit there, I can't see the services as being very well maintained or supported.
So just quickly, Kevin, I think that everybody throughout all of those communities shares your concern. This is not unique to us. I mean, this is looking at the amalgamation of many different moving pieces. So as similar to what Jane had mentioned, we are all working very hard to ensure that each catchment area is able to maintain their autonomy. This is not something that everybody is certainly worried about this. This is, a top of mind. This is in many of the meetings, a lot of the conversations, and we really just want to ensure that everybody has an equal say in all decision making. I think that is something that we're really pushing for, and you're seeing that across the board. So again, not just the rural voice and then the urban voice. Everybody has an equitable voice because we're all part of this together. And I think that in all of the meetings that we've been attending for our leadership councils and all of those things, we are seeing that equity, and everybody is recognizing that in order for this to work, that we all do have to have an equal say in sort of what is going on. And again, this is not something that's going to change overnight. It's going to be baby steps. But I think that there's a lot of, low-hanging fruit, things we can look at. Like, for example, just pathways for patient care. So, Dr. Garland, Dr. Cherian that are here, if they're sending a referral to a tertiary center, should be the same referral that a physician on Manitoulin Island is sending, like just to streamline a lot of those processes, just to ensure that we're all sort of working from the same playbook, just so that consistency in patient care, like those are a lot of the things that I think that we really just want to focus on versus looking at governance and a lot of those really big picture things. Right now, let's just focus on ensuring that some manageable things can sort of be started, and then hopefully from there those trusting relationships can be built and we can all start to continue to kind of work together. So appreciate the comment, and like I said, we've all been sort of saying the same thing all the way along in this, right? So everybody is very cautiously kind of dipping their toes in, and we want to make sure that we're doing this right. So appreciate the concern and just recognize that we're all in this together for sure.
Thank you.
I'd like to make a comment. I appreciate your presentation. It's very informative. I understand just being a part of it for a little bit. Obviously, I'm a nurse, so it consumes me lately, but what I'm finding is I like that you want to streamline things, and yet you recognize the uniqueness of every area in the catchment area. And I think that it's very important that every area in our catchment area has they have a unique need, but we need a voice to have that carried through, it's very difficult to make it all equal when it's that unique. That's what I'm finding, you know, like for our area alone, the transportation issue for appointments and stuff, specialist appointments, dialysis, those are the serious problems that we are facing in our area. Whereas in other areas, it's cancer and, you know, like the chemo trips and the CTs and stuff. So, and being on the cusp of Algoma district for Walford especially, and Massey, some of our appointments and specialist appointments go out of our district. So again, you know, keeping all those things mindful, their system may not be the same as ours. So I really appreciate all the hard work and fine tuning that it takes to, you know, surge forward on this. It's just amazing.
Thank you, Glenda. Appreciate that. Appreciate the feedback and the support.
You're welcome.
Any
Keep up
other
the good work.
questions? Any other questions, anybody? Hearing none there, I got a resolution here. Be it resolved that Nancy Lacoste and her team from Ontario Health Team Advisor be thanked for attending this meeting to provide an overview of the Espanola and Area Ontario Health Team to Council. Can I have a mover and a seconder?
I'll move.
Brenda will move it there.
I'll second.
Kevin will second it there. Kevin, you're for or against?
I'm for it.
Pat?
In favor?
Brenda?
In favor.
Cheryl?
In favor?
Dale?
In favor.
Motion carried. Thank you, Nancy, there and your group there. It's a valuable asset there that we need in this area there, and continue on with the good work you're doing there. Thank you.
Thank you so much.
Thank you.
Thank you, everyone. Have a good evening.
Have a good
Thank you.
evening.
Thanks, everyone.
Yeah, thank you.
Thank you,
Wonderful
everyone.
Yeah, wonderful presentation.
Okay, in regards to the consent agenda, be resolved that items G1 to G2 contained in the consent agenda be adopted. Anybody got any concerns or questions there?
None for me.
None.
Hearing none, can I have a mover and a seconder?
Pat moves.
Pat will move it.
Glenda
Cheryl,
second.
Oh, okay.
Kevin, for or against?
I'm in favor.
Pat?
Pat in favor?
Brenda?
In favor.
Cheryl?
In favor?
Dale?
In favor.
Motion carried. In regards to the correction for the 2020 operating surplus deficit there, I'll read the resolution there, unless, Ruth, you want to make a comment there? No,
No, just want to apologize for the error on the last one.
it's only a couple dollars there we're talking about. Okay, be it resolved that the resolution 2022-08 be rescinded and council approves the correction allocation for 2020 operating surplus to the 2021 reserves and reserve funds as per the attached schedule. A mover and a seconder.
Cheryl moves.
Cheryl, move it there. Seconder.
Glenda.
Kevin, for or against?
I'm in favor.
Pat?
Pat's in favor?
Glenda?
In favor.
Cheryl?
Favor?
Dale?
In favor.
Motion carried. Glenda, Ruth, do you want to talk about allocations there? It's pretty simple there.
Yeah, for the new funding that everyone's heard about, that was in the news, and we received notice that we would be getting a contribution, I believe, for the next 4 or 5 years. I don't have my paperwork in front of me. I apologize for that. So even though we are getting the funds, we still have to apply it to a project, and there's an application deadline for that. So because we're just in the middle of budget and finance, we thought we'd bring it to council and make a decision because we have to submit tomorrow. So I gave the 3 options that I feel probably our best options. If there's any thoughts council has on anything else.
Any comment, anybody?
Well, number two, that Caldwell Bridge replacement, I think that's a big necessity, is it not?
I would say that's the priority there.
I agree.
Yeah. I agree.
That's what we figured, because we said at last year's finance that we would be definitely doing that project this year, so,
Yeah.
Yes.
yeah.
So I guess we're all in favor.
Yeah,
Yes, we are.
Okay, be it resolved that staff be directed to to use the 2022 allocation NORD funds for the Caldwell Bridge replacement. A mover and a
I-
seconder.
I'll move that.
Kevin will move it there.
I'll
Seconder.
second it, Dale.
Dale will second it.
Yeah.
Kevin, for or against?
I'm in favor.
Pat,
Pat's in favor.
Linda,
In favor.
Cheryl,
In favor?
Dale,
In favor.
motion carried. In regards to the library receives the amount of 50% of last year's funding, that's just normal there for this time of year. Anybody got any
Yes.
concerns?
None.
None.
No.
Okay, be it resolved, the libraries have received an amount equal to 50% of last year's municipal contribution prior to the 22 budget approval. Mover and a seconder.
I'll make
Glenda
that
moves.
motion.
Glenda will move it there and Dale will second it.
Yes.
Kevin, for or against?
I'm in favor.
Pat,
Pat's in favor.
Glenda,
In favor.
Cheryl,
Favor?
Dale,
In favor.
motion carried. In regards to the storm sewer payment number 2, anybody got any concerns there in regards to that there?
None.
Okay, be it resolved that payment number 2 be approved in amount of $50,338.80 to Dennis Grattan Construction Limited for the Massey Storm Sewer Replacement Project 2021. Mover and a seconder.
I'll make that motion.
Dale will move it there. Seconder.
I'll second.
Kevin, for or against?
I'm in favor.
Pat,
Pat's in favor.
Linda,
In favor.
Cheryl,
In favor?
Dale,
In favor.
motion carried. In regards to liability claim policy application follow-up there. Kim, you want to fill us in there?
This was requested at the last council meeting that it be revisited by council. So I've provided council with a summary of the documentation that had been forwarded and circulated earlier at the time. And so at the last meeting, it was asked that we consider that council considers providing compensation for damages that were done. And I've provided you with the information from the insurance company that had suggested and recommended otherwise. So it's up to council how you want to proceed with this.
Thank you, Kim, for revisiting that and giving us all the information again. My decision on that has unchanged. I believe that we have insurance for a reason. And when they're telling us that we are denying it, then I follow that. That's why we have insurance. Everything was looked at very closely and everything was dealt with very professionally. So that is my decision.
I did notice there's a discrepancy on the date of the claim with regard to our records. What's going on with that?
What was it you're referring to?
Well, it says here the claim received indicated the incident occurred on April 22nd.
Yeah.
And by then we had already corrected the situation, I thought. Am I wrong here in understanding it?
Yeah, the written claim that was received was signed and dated May 3rd. And
we
yes,
signed
like,
it dated May 3rd, but it says it occurred on the 22nd.
Yes.
And here it says that maintenance records indicate the hill on La Cloche was repaired on April 15th. And granular B material was placed to hold it together. Then
Yes.
3 loads were applied on the 16th. So I don't,
well, it was just that the claim was, the written claim was submitted to the office afterwards. I believe it had been brought up at council during another matter that had been discussed, and the proponent had mentioned this as well. So it wasn't until after that that the written claim was submitted to the office.
so the stuff in question here is the granular B material that was applied to repair. Is that right?
I believe so.
Okay.
That's what I understand, but
Okay.
my mind is unchanged.
Well, I mean, we all get flat tires from time to time, and I
Had
mean,
3 in one day, and yeah,
Yeah.
so it goes part
frankly,
and parcel. You know, Public Works did what they were supposed to do. The insurance company did what they were supposed to do. The investigation was done and the decision was made, and I agree with the decision.
and how do you know what caused your flat? I mean, ultimately, I know where this is going to go. If Mr. Krabs is really
Well, I
intent,
didn't,
it'll
I
go
have to say, I
small
did
claims
not
court.
like his response, and it was
No,
very
it wasn't.
unprofessional. So
It wasn't very
that
professional.
was not sit well in my personal opinion.
But do we not all recall there that Mr. Krabs brought this up at a council meeting there? He was a delegation one night and he brought this up at the council meeting. Our
Yes.
council meeting was April the 14th and the 28th. And their council directed to take that B off the hill there that night. I do recall that there. Does everybody recall that being said?
The insurance company investigated all the paperwork, all the details. I think it's a moot point. If they've decided to refuse the claim, then so be it. We have to go with their advice. And it all depends on when the paperwork was filed. That's what it all comes down to. It doesn't matter when he brought it
Also,
up. I mean, there are many things brought up, so unless it's on paper, it's.
I also might add that a topic of totally different topic was being discussed.
Yes.
Exactly.
And then that was brought up. So at that time, there was nothing filed and nothing said. So that was brought up, knowing that that it was a different topic altogether from what Mr. Krabs was talking about. So.
Any other comment on this, sir? Hearing none, be it resolved that with respect to the submission claim number 21-01 on May the 3rd, 2021, respecting the Cross Lake Road, Council concurs with the position of the senior claims examiner at Intact Public Entities and confirms that this claim be denied. A mover and a seconder?
I'll move.
Glenda will move it there.
Cheryl, second.
Kevin, for or against?
I'm in favor.
Pat?
Pat in favor.
Glenda?
In favor.
Cheryl?
In favor.
Dale?
Against.
Motion carried. In regards to the Economic Development Committee meeting report, anybody got any concerns or questions there?
You had a long meeting, Glenda.
I wasn't able to attend. I was
Oh.
on call. So
Right.
actually Edie was there. I don't know. I just reviewed the report. I
Oh, yeah.
would like to note, however, that after things kind of resume, hopefully after the 31st, that we can look at starting the senior advisory committee and the age-friendly designation back up and get that rolling.
Yeah.
Okay, be it resolved, the attached Economic Development Committee meeting report on January the 18th, 2022 be accepted there. A mover and a seconder.
Pat moves.
Pat will move it. Then Kevin will second it. Kevin, for or against?
I am in favor.
Pat?
Pat in favor.
Linda?
In favor.
Cheryl?
In favor.
Dale?
In favor.
Motion carried. In regards to the Park and Recreation Committee meeting report, anybody got any concerns there? Hearing none, be it resolved, the attached Parks and Recreation Committee meeting report on January the 19th, 2022 be accepted there. A mover and a seconder.
I'll move.
Glenda will move it there. Seconder.
I'll second.
Kevin, for or against?
I am in favor.
Pat?
Pat in favor.
Glenda?
In favor.
Cheryl?
In favor.
Dale?
In favor.
Motion carried.
We have the addition of G4 on the agenda that was put on there. So both of those bylaws, G3 and G4, Ruth could probably give you a quick little rundown summary of them.
Thank you.
Yeah, so we'll do the loan renewal first. That was the last minute, just got added. So basically it is just the roads infrastructure improvement loan that was taken out in 2011. This is the remaining 5 years on that loan. So we negotiated 2.98%. So it's a little bit lower than what we were for the last 5 years. And the timing of that is perfect because they're about to all go up.
Yeah.
1.5 to 2%. So we squeaked in on that one. I think there's anything other than to go ahead with that agreement. If anybody has any questions on that.
No, it was perfect timing, definitely.
Yeah. Yeah.
Sometimes you win with the banks.
Yeah. Sometimes.
Or you lose less.
Or you lose, yeah.
Ruth, there in regards to the cemetery there, if you read that through that there, which I did there,
Okay.
is groups allowed to dig their own graves and bury them, or they got to go through the municipality?
No, it's all through the municipality now per the bylaw.
So no group can go and dig their own, or?
No, we don't allow it anymore. In 2021, we had a contractor dig all of them.
That would be a nightmare compensation wise and whatnot.
Liability.
Yeah.
Yeah.
Yeah. Well, and it gets harder now too, because the problem being with it's more cremations now than ever. So when you buy one plot, they are gonna use the 6 cremations. They buy it for their whole family. So if we have family members going there, even though we mark the plot, we're not there at every burial. If they're burying cremains in some other spot than what we're marking, and they want to fit 5 more cremations into that plot, and we have no idea where the burials are happening, it does become a nightmare. So even liability in other areas too. But I did have, at the beginning, we had some people like, well, we buried my parents, or we dug the hole. This year I didn't find any really pushback or anybody was upset by that or anything. So
no, that needs to be controlled for sure.
Yeah. So
Any other?
Sorry, go ahead, Les.
Yeah. Any other questions, anybody?
I saw something about the concrete pad. It has to be level with the ground.
That was for flat marker, Dale. And why I made that change there was the dimensions of the concrete pad around. The dimensions that were in there didn't make sense if a monument was going to install a pillow, because the way a pillow is, we said there had to be 4 inches left around the outside of the granite base. they couldn't do that. It was impossible with the measurements that were there. So we didn't catch that. So we just made it make sense there.
Okay, so the concrete base, you want it level, you want it at ground level, and then the granite
Yes.
can sit on top of it.
Yes, exactly. Yeah.
Very good, thank you.
And then the other, and why I took the opportunity to make these corrections was because we had to change a bit of it due to the increase in the care and maintenance contribution for 2022, which is legislated by the province. So through the FBSC Act. So.
Any other questions, anybody?
None.
Hearing none there, be it resolved that the following bylaws be read a first and second time. Bylaw 2022-07 being a bylaw to enact rules and regulations for all cemeteries owned and operated by the township. Bylaw 2022-08 being a bylaw to authorize the renewal of borrowing. Bylaw 2017-10. Mover and a seconder?
Glendale move.
Seconder?
Dale will second.
Dale seconder. Kevin for against?
I'm in favor.
Pat?
Pat's in favor.
Linda?
In favor.
Cheryl?
In favor?
Dale?
In favor.
Motion carried. Be it resolved the following bylaws be read a third and final time and passed in open council. Bylaw 2022-07 being a bylaw to enact rules and regulations for all cemeteries owned and operated by the township. Bylaw 2022-08 being a bylaw to authorize the renewal of borrowing. Bylaw 2017-10. Mover and a seconder?
Pat will, Pat will move.
Seconder?
I'll
Cheryl?
second. Okay.
Cheryl? Kevin for against?
I'm in favor.
Pat?
Pat's in favor.
Linda?
In favor.
Cheryl?
In favor?
Dale?
In favor.
Motion carried. Kim, have you got anything else for tonight there, or is that it?
That's all I have for the agenda tonight.
Okay, anybody got anything else before we adjourn there?
Yeah, I have a few concerns. The phone lines at the Massey Clinic are becoming a problem. The two doctors are each on a line steady doing phone appointments. Another line, and they did add lines when the pandemic started. And, you know, the other lines used off and on by whoever else. Half the time you try to call in there to book an appointment and you get the answering machine. So then they call you back, and if you're not home, it's becoming a struggle. And I had a chat with Marla about it the other day. And you know, they said, well, they were thinking of going to a new phone system. And I said, well, let me bring it to council. And you know, I think we need to upgrade the communication system there, because we don't know how long this phone appointment pandemic thing is going to go on. What's it going to cost us to, you know, I don't think it's going to cost us a huge amount of money to upgrade to a fifth line or something there. Like, I don't know what the logistics are with Bell in terms of how to do that, but certainly we can do it. You know, I think that's the least we can do to help get through this, because it's a real problem.
Who's going to answer this fifth line though, Kevin?
Well, the receptionist is going to answer it.
And she's already on the phone with somebody.
Not necessarily. If she sees that there's another line and she's on hold, you know, for whatever reason, there has to be a solution here, because it's like, and the answering machine, the answering service or voicemail, whatever you want to call it, doesn't necessarily work all the time. There's issues there, you know.
You know, a lot of the clinics or whatever, I'll give an example, Espanola, like they have those lines, and the receptionist answers with whatever clinic they are, and can you hold please? And then they get the lines, and then they're able to go back, you know.
Yeah.
So, and that gives the person the opportunity to either hang in there or hang up.
That's right. At least you've been acknowledged. At least you've been acknowledged, And you know
Yes.
you're gonna talk to somebody shortly.
That's the big
Yeah.
thing. Yes. Yeah.
What's there isn't working, is what I'm saying. There has to
agree.
be a solution. And so, Kim, it would be nice if you could talk to Marla and see what they want to do, bring it to council. And
Yes, this hasn't been brought to my attention at all, so I will talk to Marla and
please,
make some kind of a recommendation or presentation to council. We'll see what options are.
okay, great.
Can
The
I
other
just
thing-
add something quickly, that I did recommend a newer phone system to Marla earlier on, and we have that on capital budget.
Okay.
Just to discuss in
There you
finance
go.
as well.
She did say there had been discussions about a new phone system, but
Mhm.
we got to get it done soon.
Yeah.
You know?
But it's good to know that, you know, not only does it need to be a new phone system, but the capability to have many lines to
Yes.
access. Yeah.
Yeah.
And the phone system there is a little antiquated, like
Yes.
considering. And I know one of the problems is when you call to leave a message, it doesn't beep right away, but people think it's beeped and they leave a message, but then they hang up before that beep. There's like a pause there for some reason. I
Yeah,
don't know.
it's a long pause. Yeah.
Anyway, it's served its purpose, but you know, phones change at the drop of a hat, so.
That's
Are
our
there any-
medical. That's our medical facility. You know.
Are
what
there
I
any
mean?
other
Yeah.
suppliers? Is there anybody else besides Bell that we can approach as far as competition?
Eastlink is another one.
Oh, don't get tangled up. with
You're gonna
Eastlink
change
and
all the
Telford.
phone numbers? You're
No,
gonna change
I'm
all
just
the
saying,
phone numbers? Oh,
he was just asking if there was another supplier, and that's
I
not
thought that-
necessarily true of changing the phone numbers,
That's right.
because I know
Oh.
of one place
Yeah.
where I work where they've changed the system from Bell to Eastlink, and
Okay.
so now we have like 12 lines, and it's
Yeah.
much more efficient.
It's the same number.
You know,
Same
and
number.
it's all inclusive with your internet and everything. So it's really, it's a life-saving system as far as I'm concerned. There's more than one competitor out there that can offer these services. So
Sometimes though, there's been issues with Eastlink phone service. So
yes.
I mean,
Yeah.
I don't know
And
firsthand,
with
but
Bell
I hear
and with other ones, yeah,
I got to agree.
yeah.
Bell hasn't been standing up like they were in the past.
Okay, Kim will look into it anyway. Any other concerns, anybody?
Yeah, I have one other thing. What's the whole situation with the Ag Society there? Can you give us some clarification on that?
Well, that was misinformation, misunderstanding. The last meeting, we did a resolution to formalize Councillor Rivers as being a council rep on the Massey Agricultural Board. And we did that because we had acknowledged that he had attended meetings last year from his attendance sheet. So he was paid for those meetings. And although he was paid for them, Ruth couldn't find the backup documentation to support that, which she likes to put together when the auditors request that type of material. So we formalized the resolution. And when we sent it to the Ag Society, little did we know that, we didn't know that they request for council liaisons or council representatives, and they hadn't. And I said, okay, I'm sorry, it's our misunderstanding. And the secretary said, well, no, leave it with me. We have a board meeting coming up and I'll bring it forward. So I guess at their meeting last week, they brought it forward. And I guess the board had decided against requesting a council representative at this time, so.
I was at that meeting. They went into closed session. But I guess what I want to clarify right now is I didn't mislead anybody by saying that I was expecting anything. I know when I first got on council, I spoke with Glenn and she said, log every meeting you're at. So that way there's a record of what you've done. Now, I know when I mentioned it to Kim, she understood. Ruth just shook her head no. Glenn, did you remember our conversation about that?
What I remember is when the Agricultural Society came to our meeting and approached us and discussed about having somebody from council attend the meetings, that's what was decided then. So that was a verbal agreement. There was nothing actually written in stone, but it was on the onus that, you know, somebody from council would attend the meetings to, you know, to answer any questions or bring back information at that time. So I understand just from the minutes of the meeting that I am seeing from the Agricultural Society that things change very quickly, very fast. Some things happen and then they get rescinded. So I'm on the onus that at the time that the discussion took place, Dale said that he would attend, you know, just, and I believe that in, you know, in good faith that he was attending so that he could bring information back. That's how I feel about it.
And I plan on continuing attending.
Yeah. And at that time, they were saying they would like council to have a, you know, somebody from council there. So to me, that's kind of like a handshake deal, if you want to call it that, you know, and then, but like I said, there's been decisions made through the Agricultural Society just from me observing that, you know, they don't really write anything in stone. They just kind of make decisions abruptly and then rescind the decisions abruptly. So that's something we have no control over, of course, but we do want to help them out and participate. So sometimes they reach out, sometimes they turn away. So
Okay, any other concerns, anybody, or questions there?
Can I just make a comment, please, on that? I was just shaking my head, Dale, is only because I don't want on council attendance sheets every meeting you attend. Those are only for the meetings that you are to get points for. So that was part of my confusion as well. I can circulate the policy again.
You don't have to.
Yeah, it's just,
I asked the counselor about it when I first got on, and that's what.
Yeah,
took
sorry.
Conversation just so that people knew what, you know, what I had done, but it wasn't about a money grab.
Yeah, no, and that's what I mean. It just gets confusing too if I'm getting your attendance for everything you are attending. The attendance sheets I give you are only to pertain to that policy. And council meetings, I actually identify columns and then the odd other where people go, but that's all. So that's all I wasn't, because I think
it's fine.
Did have a rep on that.
I appreciate that, Ruth, because the simple fact that was before we accounted for every meeting that we went to or every event that we went to or anything like that. And that's what we were told to do. So moving forward with you in there, I kind of like it because it's like I have to record less instead of more.
Yeah.
You know, like public health is not paid, like I don't get points, like that's a separate entity, but I was told I had to mark that down before and then you know, so it's just different. And thank you for clarifying that. Appreciate that.
No problem.
Question, Ruth. So when I go to a DSAB meeting, I don't put that on my sheet?
No, I don't need to see that, Kevin.
How about meetings with the province at the direction of council?
Yes.
Like I had one.
Be another.
Yes.
So I would submit that?
Yeah. Yep.
Okay.
Yeah. So that would be under the other. And then, so things like that, I'll ask for clarification, just what was it?
Well,
but yeah.
And you did, and that was fine. But I just, there's no sense me putting them down if it's just gonna.
That's right.
People. That's fine.
More work for you, Ruth.
Yeah.
Because I put all my DSAB meetings on there. I didn't know.
Yeah, I know.
That's fine.
Yeah.
Okay, any other concerns, anybody?
No.
I just thought of this water power thing again. Kim did look into it, and it turns out that site that I thought that lady that explained it from that corporation explained that there was a possible site where there was an X marked on the map. So I had been asking if we could get clarification where it was so we could possibly consider looking at developing. Kim has approached them a couple times and that lady no longer works for them. And I think in her last phone call with them, it's been determined that that X or star that was on the map is simply the water hydro generating plant that's already in existence on the river at the 8 Mile. I think, right, Kim, did I say that correctly?
Yeah, yes, you have that totally correctly. I have followed up since that time as well, though. And she told me how I can navigate their website under our account to show where there may be areas that have been designated as potential sites because of their locations. So we're still working on that, and I'm trying to get through there and get that information to see what they're going to provide for us. And I'll circulate that to council when I get it.
Excellent. Thank
Yeah.
you.
Yeah.
Any other questions, anybody?
Well, I have a comment. Like I said, with us hopefully reopening a little bit, I want to see if we can get the age-friendly established again in the senior advisory committee. I've had several calls from people in regards to looking at transportation for dialysis and appointments and stuff. And I think we have to kind of hopefully look into or tap into some funding so that we can get some transportation means, even on, through a different source, maybe approaching the Espanola CCPN to see if they have any outlets where we can utilize them for our residents in Massey, Walford, Webwood, to get them to appointments that they direly need. It's not something that's just off the cuff, like when somebody has dialysis, it's usually 2 to 3 times a week on a regular schedule, for the duration. So I think if you can all just put your ears out and mouse out and, see if anybody's interested in engaging in this subcommittee, it would be much appreciated.
When we met with Sagamore before the pandemic, I was hopeful because of the service that they were talking about, maybe we could tap into that and support that service and watch it grow. But then with this pandemic, I see that, we haven't moved forward at all. So.
No, unfortunately, with the Indigenous communities, their funding is inwards and not outwards. They look after their communities, and I'm very happy to see that they do that. But it's difficult to pair up with some kind of service like that. So I'm looking towards more of, like I say, the care planning network where John Bernetti is, that kind of thing. If we can tap into some of those services so that we can get at least committed to 1 day a week transportation and arrange it for the people that have regular appointments.
Yeah, that'd be a start.
Yeah,
there's some extra funding that's come to DSAB as well there for non-urgent patient transfer, and so I'm hoping now, believe it or not, they do a lot. They do a lot under the table for us too. DSAB, they're not necessarily getting paid for stuff, and it gets done anyway. So. But with regard to Sagamore, the clinic had approached them when we had issues with the dialysis patient transportation. The clinic approached Sagamore, and they were told flatly, like, no, absolutely not. That's only for us. So
and that's what I said. Unfortunately, that's the case. So we have to reach east. I guess we just have to reach east and look into that, because there are dialysis patients that desperately need at least once a week a ride. They can arrange other times during their treatments, but at least once a week. And the people that are helping them and driving them are not young either. Like there's volunteers that are just amazing, and they can't keep up. They just can't keep up.
That's right.
And I'm really, really happy to see that there are volunteers out there to do that. But if we can tap into some funding to at least offset something, or I don't want us to get so committee-like that people don't want to be involved anymore. You know what I mean? In the spirit of just helping somebody would be wonderful, and trying to look for some funding or some helping hand somewhere.
Yeah.
I think that was also brought up in the La Cloche Foothills Community Safety thing as
but
well.
Again, it seems to be hitting towards Manitoulin, Espanola, Nairn. It doesn't seem to be coming west to our area. And I think that we're kind of on the tail end of it, because we're on the cusp of Algoma District, and some of these appointments are in Algoma District. So it makes it difficult to really navigate getting services, because we are so close to the border of the districts. So it does get mishmashed together sometimes. So
There are a couple fronts we can approach it on though, so.
Okay, and that's what I was just gonna ask. Kevin, you said there might be some DSAB funding available?
Well, there is some new funding coming there for the paramedic people for non-urgent transfer of patients. I'm sure there was something there already, but I think there's additional funding.
Yeah, there is non-urgent transportation like Platinum and different ones that, you know, might be able to provide some kind of service because they have the insurance and stuff like that. So yeah, it would be nice to have a partnership developed in some form.
It sure would.
Yeah.
One of the things we have to keep in mind is that Sagamok is funded by the federal government.
Yes.
And we need to find provincial monies.
Yes.
That's
And
right.
My
All the
point
indigenous
was-
communities are, yes.
My point was at that meeting that we had with them, I thought maybe we could actually pay to have that service and somehow, whether we pay with a patient or whatever, but I just thought that there was a chance that that transportation system could grow enough that we could take advantage of it. It wasn't about trying to get anything for free. It was about supplying them with enough business for them to keep going. But I mean, again, once the pandemic hit, everything kind of stopped.
Yeah, I
Unfortunately for
understand
that deal, being a federal and we're provincial, they're federal. So they have their stats that they have to create. They have to, you know, the different funding sources that they have, they have to report how they're dealing with it. So we're not included in that, unfortunately, because we're of a different level, provincial level.
I
and they're
understand that
federal.
now.
Yeah.
I understand that now.
Yeah.
But it doesn't hurt to talk. Any other concerns, anybody, or questions there? Hearing none there, be it resolved at the time of 7:15 PM and this meeting be adjourned to the next regular meeting or the call of the chair. A mover and a seconder.
I'll move.
Move it there. Kevin, was that you that seconded it?
That was me, yes.
Yep. Kevin, you're